Hi, Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. And in this installment, we are going to be going over ADHD. And the first one we want to go over is what ADHD is and the signs and symptoms of it. Before we begin, let me just remind you to please watch the full video because in the video there will be 3 key words that will be mentioned. When I get to the keyword, I will say keyword and then what the keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. What is ADHD? Well, ADHD is short, first of all, for Attention Deficit Hyperactivity Disorder. And it normally starts in childhood. Attention Deficit Disorder, or ADHD, is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and keyword impulsive behavior. Children with ADHD may also struggle with low self-esteem, troubled relationships, and poor performance in school. Symptoms sometimes lessen with age. However, some people never completely outgrow their ADHD symptoms, but they can learn strategies to be successful. While treatment won't cure ADHD, it can help a great deal with the symptoms. Treatment will typically consist of medications and behavioral interventions. Early diagnosis and treatment can make a big difference in the outcome, though. So what are some of the symptoms of ADHD? How do we know if our child may or may not have ADHD? Well, the primary features of ADHD include inattention and hyperactive impulsive behavior. ADHD symptoms start before the age of 12, and in some children, they're noticeable as early as 3 years of age. ADHD symptoms can be mild, moderate, or severe, and they may continue into adulthood. ADHD occurs more often in males than in females, and behaviors can be different in boys than it is for girls. For example, boys may be more hyperactive, and girls may tend to be quietly inattentive. There are 3 subtypes of ADHD. The first one is predominantly inattentive, which is the majority of symptoms fall under inattention. And the second one is predominant hyperactive impulsive, where the majority of the symptoms are hyperactive and impulsive. Excuse me. And then the third one is a combination of both of them. This is a mix of inattentive symptoms and hyperactive impulsive symptoms. Now, what is inattentive? Well, inattention is when a child who shows a pattern of inattention by failing to pay close attention to details or make careless mistakes in schoolwork. They will have trouble staying focused in tasks or play. They will appear not to listen, even when spoken to directly, have difficulty following through on instructions, and fail to finish schoolwork or chores. They will have trouble, keyword, organizing tasks and activities, avoid or dislike tasks that require focused mental effort, such as homework, lose items needed for tasks or activities, for example, toys, school assignments, pencils, or they could be easily distracted and forget to do some daily activities, such as forgetting to do chores. Now, the second one, which is a hyperactivity, impulsivity, we're going to cover what that is, which is a child who shows a pattern of hyperactive and impulsive symptoms may often fidget with or tap his or her hands or feet or squirm in the seat, have difficulty staying seated in the classroom in in other situations, be on the go in constant motion, run around or climb in situations where it's not appropriate, have trouble playing or doing an activity quietly, talk too much, blurt out answers interrupting the questionnaire, they may have difficulties waiting for his or her turn, and interrupt or intrude on others' conversations, games, or activities. Now, the third one that we mentioned, we're not going to discuss yet. Now I want to talk about the typical developmental behavior versus ADHD, because sometimes they can get confused. So most healthy children are inattentive, hyperactive, or impulsive at one time or another. It's typical for most preschoolers to have short attention spans and be unable to stick with one activity for long. Even in older children and teenagers, attention span often depends on the level of interest. The same is true for hyperactivity. Young children are naturally energetic. They often are still full of energy long after they've worn their parents out. In addition, some children just naturally have a higher activity level than others do. Children should never be classified, excuse me, children should never be classified as having ADHD just because they're different from their friends or siblings. Children who have problems in school and get along well at home or with friends are likely struggling with something other than ADHD. The same is true of children who are hyperactive or inattentive at home, but whose schoolwork and friendships remain unaffected. So when should you see a doctor? Well, if you're concerned that your child shows signs of ADHD, see a pediatrician or family doctor. Your doctor may refer you to a specialist, such as a developmental behavior pediatrician, psychologist, psychiatrist, or pediatric neurologist. But it's important to have a medical evaluation first to check for any other possible causes for your child's difficulties. So what causes ADHD? Well, while the exact cause of ADHD isn't clear yet, research efforts continue. Factors that may be involved in development of ADHD include genetics, the environment, or problems with the keyword central nervous system at key moments in development. Are there any risk factors involved with ADHD? Well, excuse me, my throat is dry. Risk factors for ADHD may include blood relatives, such as a parent or a sibling with ADHD or another mental health disorder, exposure to environmental toxins, such as lead, found mainly in paint and pipes in older buildings, maternal drug use, alcohol use, or smoking during pregnancy, premature birth. Although sugar is a popular suspect in causing hyperactivity, there's no reliable proof of this. So if you think that sugar is the reason why your kids are jumping off the walls and stuff, there is no actual proof that that's the case. Many issues in childhood can lead to difficulty sustaining attention, but that's not the same as ADHD. So, what are the complications of ADHD if a child has it? Is there any complications? Well, ADHD can make life difficult for children. Children with ADHD often struggle in the classroom, which can lead to academic failure and judgments by other children and adults. Tend to have more accidents and injuries of all kinds than do children who don't have ADHD. They tend to have poor self-esteem and are more likely to have trouble interacting with and being accepted by peers and adults, and are at increased risk of alcohol and drug abuse and other delinquent behavior. What if there's any coexisting conditions involved? Well, ADHD doesn't cause other psychological or developmental problems. However, children with ADHD are more likely than others to also have conditions such as oppositional defiant disorder, otherwise known as ODD, generally defined as a pattern of negative, different, and hostile behavior toward authority figures. Conduct disorder, marked by an antisocial behavior such as stealing, fighting, destroying property, and harming people or animals. Disruptive mood, dysregulation disorder, which is characterized by irritability and problems tolerating frustration. They'll have learning disabilities, which include problems with reading, writing, understanding, and communicating. Substance use disorders, including drugs, alcohol, and smoking. Anxiety disorders, which may cause overwhelming worry and nervousness, and include obsessive compulsive disorder, better known as OCD. They could have mood disorders, including depression and bipolar disorder, which includes depression as well as manic behavior. Autism spectrum disorder, which is a condition related to brain development that impacts how a person perceives and socializes with others. And tic disorder or Tourette syndrome, disorders that involve repetitive movements or unwanted sounds, better known as tics, that can't be easily controlled. Excuse me. So, knowing this, is there any way we can prevent our child from having ADHD? And I like teaching about this part here, especially because there is a big stigma around about mental health and people that have it. They tend to get pushed aside like it's a disease that's contagious. Well, it's not contagious. If a person has any type of mental disorder, you can't get it from them. But we also need to know that in a lot of these disorders, there's no way of preventing it. There's no way of knowing your child is going to have it. You could go through all the risk factors and not have any single one of them, and your child could end up with ADHD. It's just not known exactly why it happens. So, for the prevention to help reduce your child's risk of ADHD, they suggest avoid anything that could harm fetal development. For example, don't drink or use, smoke or use any recreational drugs. They also suggest that you protect your child from exposure to pollutants and toxins, including cigarette smoke and lead paint. And limit screen time, although still unproved. It may be prudent for children to avoid excessive exposure to TV and video games in the first 5 years of their life. Now, like I said, that one has not been proved. But if you go back to this, we all know people like my age, if everything they felt against, okay, I've known people that both parents don't smoke, they didn't drink, they didn't do drugs or anything like that. But you have to remember, before the newer housing codes, most houses use lead paint. So that would mean if lead paint was the extreme, was one of the causes, that 99% of the adults around my age would have ADHD. Because we grew up in homes that had lead paint before it was banned. If you ever buy an older home, a lot of older homes have lead paint. Okay? There's been reports of lead being in the water. So it's not exactly sure on what causes it. These are just some of the possible things and the best way to give your child a better chance of not having it. But I implore each and every one of you that watch this, don't prejudge somebody that has any type of mental illness or physical illness or no illness at all. We shouldn't be prejudging one another. It's not our place to do it. We don't know what the person's going through. We're not walking a mile in their shoes. Don't judge a book by the cover. And don't judge a nut by the shell because you don't know what's inside that nut. I don't know if anybody's heard this, but you might have heard the old saying, you could see like somebody that would look like a perfect, what we would consider a perfect 10, but have somebody say they're ugly. It's because of the inside here that makes them ugly. That's why you don't judge by the cover. Because this can be beautiful, but inside here could be the most ugliest thing. It could be like a disease, a festering type of cancer. It can be so ugly and rotten that it's horrible. That's why it's always better to look with the heart and not with the eyes, because the eyes aren't going to see that. Only the heart can. That's invisible to the eyes. I know they say the eyes is the doorway to people's soul, but it's not true. The heart is the doorway to the people's soul. Because when you see from within, then you can see what that person's about. Never judge somebody. And if somebody does you wrong, remember, 2 wrongs don't make a right. All you're going to do is make the matter worse. Be the better person, the bigger person. And if you can, walk away. It's much easier and healthier for you to forgive somebody than it is to hold a grudge. When you hold a grudge against somebody and you're mean or spiteful or whatever, you're only hurting yourself. When you're happy and you're forgiving and loving, you release chemicals called endorphins inside your body that heal you both physically, mentally, emotionally, and spiritually. Positive actions and positive words have positive effects. Just like negative actions and negative words will have negative effects on your body. So to remember, I'm talking to you out there because this is important for me to get out to all of you. So I'm talking to each and every one of you, one by one. Remember, you are uniquely made. You're one of a kind. You're a gem. Don't let anybody ever tell you you're different. Excuse me. You are very special. And you matter to me. Each and every one of you are important because we were all created equally. None of us better than each other. And I love you for who you are, for what's inside here. Okay? Don't be a cheap imitation and copy somebody. I don't care if it's on or off of YouTube. Be yourself. When you copy somebody, you're going to lose those that are close to you. You're going to lose friends. Yes, you can't please everybody in this world. Don't try to. Excuse me. But at the same time, be an original. Be you. I'm not trying to copy nobody. I'm just me. If people like me, that's fine. They don't, well, that's their choice. But be loving and understanding. And when you speak to somebody, if you're trying to correct something that you think is wrong, let them know you're not trying to hurt them or anything else. Let them know how you feel. If they can't accept that you're being an adult and being honest and upfront about it, well, that's not on your chest, that's theirs. You're being the friend that you need to be and trying to help them to stay who they are so they don't lose their other friends. Sometimes people don't see what they're doing wrong as wrong. Or even if they say something wrong, they don't think it's wrong. And they don't realize it until it's too late. Be there for them. Even if their idea changes about you and they seem to drift apart from you. Be there for when they fall. That's what a good friend is. That's what seeing from your heart does. Be there. Don't be the one to say, I told you so, or I warned you. Be there for them when they fall. To lift them up and encourage them. And say, that's okay, we all make mistakes. Nobody's perfect. I still love you, and I'm still here for you. Alright, so until we see each other again, bye, I love you all. Have a great and blessed day.